Hello, everyone, and welcome to today's industry webinar, General Provider Telehealth and Telemedicine Toolkit. My name is Ellen Knowles. I'm the Marketing Communications Manager here at Azalea Health, and I will serve as your moderator for today's presentation. Before we get started, I'd like to go over a few items so you know how to participate in today's event. All attendees are in listen-only mode. Do know that the system defaults to your computer audio. So if you would prefer to join over the phone, just select telephone and the audio pane on the right-hand side of your screen, and the dial-in information will be displayed there. You will have the opportunity to submit your questions during today's webinar. We will address them at the end. We would love to have a very interactive Q&A session, so we encourage you to send in your questions. Also, please keep in mind there are always new updates being released frequently. So if you have any questions that we're unable to address during the session today, we will follow up with you separately. Also, the slides will be shared in a follow-up email along with the webinar recording. I would now like to introduce our presenter. We have Margaret Chandler, Azalea's Clinical Regulatory Consultant. And with that, I'll go ahead and turn it over to you, Margaret.
Hello, everyone. We really appreciate the time that you're giving us for these webinars. We know it's not easy to carve out time like this, so thank you so much. Our topic today, we have been focusing on COVID topics, but that's kind of calmed down a little bit as far as releases with regulations and waivers and things like that. So today we're going to talk about telehealth, because telehealth was really, has really come into its own since COVID. And so there was, back on March 17th, I believe, there was a fact sheet that was issued, and CMS also published a telemedicine toolkit. So that's where this information that I'm presenting today is coming from, the fact sheet and the toolkit, and I have links to both of those at the end of the presentation. Now, why this is such a big deal, or pretty big announcement, is that prior to this announcement in March, Medicare was only paying for telehealth services for basically routine visits, and then only in certain circumstances. For example, the patient, he could not be talking to the doctor from their home. They had to be in a local medical facility to get services from a doctor somewhere else, which is kind of crazy. But now they can, they can be at home and talk to their doctor. So just some odd things like that they kind of cleaned up. So I'll just jump right into it. Sorry, let me switch. This is the wrong slide here. Is this the whole? Yeah. Okay, had an extra slide in there. Okay, so there are basically 3 types of services: the telehealth visits, the e-visits, and virtual visits. So the first one we're going to talk about is this telehealth visit. And this is a visit with a provider that uses telecommunication systems between a provider and patient. So it's basically a telephone visit. And the details about that one are that these are the codes that you can use, G codes, HCPCS, CPT codes. So you can even use your office visit codes in addition to the telehealth consultations, which is nice. And then there's a link here, the complete list of codes. There are more codes than that you can use, but those are the most common ones. So what I wanted to point out about that link that takes you out to the list of codes, now that's a download. So when you click on that link, it's just going to download a list of codes. It's not going to come up to a different page or anything. So sometimes people think the link doesn't work, but just look, wherever your downloads go to, and that's where your codes will be. Other important pieces about billing for these telehealth visits are that you can bill immediately all the way back to March 6th. So if you had some telehealth visits and you didn't know how to bill or didn't know that you could bill, go ahead and bill for those now. You will be paid under the fee schedules, physician fee schedules or fee for service, IPPS, those same fees as the same amount as inpatient or in-person services. So there's no discounting or lower fee for telemedicine or telehealth. Of course, the patient will still need to pay their co-insurance and meet their deductibles, all of that kind of thing. The only thing that they're flexible about is the cost. They're waiving the cost sharing for telehealth visits paid by federal healthcare programs. So, the links that I provide will let you delve into that a little bit more if that applies to you. And then the last thing that I wanted to share with you about the Medicare telehealth visits is that no approval is needed for the state Medicaid programs to reimburse. So they should just work in the same way, same rates that they pay for face-to-face visits. So I think all that's pretty good news. Hopefully you will think so too. So each of these visit types, they have a patient relationship with the provider, meaning the patient relationship is a new patient or it's an established patient. So for the telehealth visits, it says it can be new or established patients. They really want it to be established, but at the same time, they said they're not going to do any audits on your claims, just check and see if that was a new or established patient. So, that's up to you if you want to stick to the established patients, or if since there's not going to be an audit, you want to go for the new patients. That's an internal decision. And you would need to look at the 1135 waiver regarding these established patient relationships. So links out to the waiver are in the toolkit, so you'll be able to find that. So the next one is virtual check-in. What's the difference? What's a virtual check-in? It's a brief check-in with your practitioner via telephone or other telecommunications to decide if they need an office visit or some other service. They think this would be about 5 to 10 minutes, and it doesn't even have to be live, if you will. The patient can send you a recorded video or pictures, images, if they're an established patient, and you can determine whether or not they need an office visit or other service from whatever they have sent you. So that's where the virtual comes in. It may not be live. It might be an email or however securely that patient wants to communicate, hopefully through a patient portal, because that is secure. So virtual, the main thing about the difference in telehealth visits and virtual visits are that the telehealth can be either new or established, but these virtual have to be, in order to bill for them, they have to be existing or established patients. And this one is, none of these are related or restricted to any rural settings or certain kind of location. The other thing that I found interesting that they wanted to mention is that these services need to be agreed to by the patient. So I don't know, does that mean that some providers just started having virtual or telehealth visits with their patients and the patients didn't like it? I don't know what that means. Anyway, just make sure that that's what your patient wants, is a telehealth or a virtual visit. And so you can respond by telephone, audio, video, secure text, patient portal. So there again, in both directions, it can be, it doesn't have to be live. So that's what the service is. There are two HCPCS codes, G2012 and G2010, and it's for established patients, like I said earlier. So the next one is the e-visit. And what is an e-visit? It's a communication between a patient and their provider through an online patient portal. So the others, the first one, telehealth, is telephone, talking to them. The second one, virtual, you may or may not talk to them. It might be through a patient portal, but it could be all of those other types. This e-visit is strictly through your patient portal, and there are 6 PICS codes that you can use, and this is for established patients only. The other key point, important thing to remember, is that the patient must generate the initial inquiry, and the communications can occur only over a 7-day period. So if it's outside that 7 days, then that's another visit. So obviously they'd have to pay another copay or co-insurance, whatever they have. We talked about the established relationship. This is not limited to any geographic or any kind of location restrictions. And these services also need to be initiated by the patient. However, you can educate your patients that this service is available. So, you know, I highly recommend that you send out a message through your patient portal that if you're offering these services, that it's up and ready to go. Now, Azalea does have a great telehealth module. So if that's something that you think you would like or your patients would like, please contact your customer success manager, or, you know, obviously anyone at Azalea, but ideally your customer success manager. We've got the codes there. That's the 6 codes. And then, of course, the co-insurance, copays, deductibles would still apply to the e-visits. All right. Just the summary, like the key points to take away for this is an expanded benefit from CMS, and it says this on a temporary and emergency basis under the 1135 waiver. However, they're encouraging providers to make it a long-term permanent thing. So clearly they're going to offer some other kind of telehealth, telemedicine program after the emergency is lifted. They are encouraging you to share with your patients that you have these new capabilities. And the other thing that is a piece of this toolkit is that there's a HIPAA waiver during the COVID lockdown, during this emergency period. And that HIPAA waiver is specifically for telemedicine because it allows you to use common programs that you typically would not be considered secure or protecting health information. So, you know, for example, you could use FaceTime, Skype, WhatsApp, whatever program works for you. For now, you can use that without being concerned about HIPAA privacy laws. So, you know, while you're getting up and started, that's a pretty big deal because, you know, most people have at least one kind of app that they can work with. So those are the key points, key takeaways. The links at the bottom is the link out to the toolkit, and it has pages and pages of links for things that will help you, whether it's a waiver, whether it's the HIPAA, you know, everything you could think of in that toolkit. And then the link that says effective March 17th, 2020, that is a link out to the press release / fact sheet when CMS released these details about the telehealth program. So I highly recommend that you look at those 2 links, and both of them have other links that will take you other places. And really, they've done a very good job answering questions, frequently asked questions, more fact sheets. So if this is something you're interested in, I can't recommend enough that they've got it well documented. So I think that is our last slide. Thank you so much for your time and attention.
Thank you, Margaret. We are now going to answer questions submitted during the presentation. And as a reminder, you can still submit your questions in your attendee control panel. Our first question asks, is this just for providers?
I assume that question means providers as opposed to hospitals. And no, it is for both hospitals and individual physicians or groups of physicians.
Great, thank you. Our next question asks, can we go back to March 17th and bill?
Actually, the fact sheet was released on March 17th, and the toolkit says assume that this is effective March 17th, but it also says that it goes all the way back to March 6th. So I would at least go back to March 17th, if not March 6th.
All right. And our last question so far is asking, which waiver is needed?
There are several waivers that might apply, and those are listed in the toolkit. However, the main one is that 1135 waiver about the emergency response for COVID.
All right, we've got a couple more that have come in. Is an authorization from the patient encouraged or required?
And authorization it is encouraged. It is not required to treat the patient via telehealth or telemedicine. It's not a requirement, just a recommendation.
All right, and this next one is asking, can this be used for patients that are in other states and are unable to travel due to compromised immune systems?
The short answer is yes. However, it would depend on your state laws about practicing across state lines. So you would need to look at the two states and see what they allow. But as far as Medicare is concerned, it is allowed. Just check your state laws.
Great, thank you. That actually is all the questions we've had submitted so far. We can wait another moment and see if we have any additional questions. And while we take a moment to give attendees time, I want to ask Margaret, is there anything else you would like to add as far as common questions that you've gotten related to this topic?
You know, the practicing or the seeing patients from different states, that was a really common question. So that, you know, that's one. The other common questions is really kind of specific to Azalea and about our, you know, whether or not we have a telehealth module, which of course we do, and then, you know, about setting it up and cost and all that kind of thing, which, you know, that's not in my area of expertise to address. But I would, you know, at least get a demo, take a look at it. It's not very expensive, and it can really make a big difference for you and your patients.
Great, thank you for sharing that. We did get one more question. Do you need modifiers while billing out for rural health clinics for telehealth visits?
Not in anything that in any of this toolkit information, I did not see anything like that. I think that if you need modifiers for your face-to-face visits, that you should use those same modifiers for telehealth, because they're saying bill it the same as face-to-face visits. So that would be my rule of thumb. If you currently use the modifier, continue to use it. If you don't use it now, then I would not use it.
Great. All right. Well, it looks like we have answered all the questions submitted today. So we will go ahead and conclude today's webinar. If there are any other additional questions that you come up with following today's call, we'd be happy to try to help guide you in the right direction via email. Thank you to everyone for attending today's webinar, and a special thanks to Margaret. As a reminder, the slides will be shared in a follow-up email, which will also include a link to the recording if you want to review again, or you can also share with any of your peers. On behalf of Azalea Health and our presenter, thank you for joining us, and have a great rest of your day.
Thank you, Ellen.